The former CDC Director, that's Dr. Tom Frieden, says the fight against the coronavirus is just beginning. He told lawmakers yesterday the U.S. death toll could reach 100,000 by the end of this month. Right now, the death toll is a little over 74,000. Dr. Anthony Fauci was asked to testify at that hearing, but the White House said no to that. Dr. Frieden is the president and CEO of the initiative Resolve to Save Lives, which works to prevent epidemics. Good morning to you, Dr. Frieden. It's really good to see you. Listen, I know that you are not a man who is careless with his words. You have Good morning. You have tremendous expertise. You are not careless with your words. So what caused you to make that prediction yesterday? What are you seeing?
Unfortunately, the numbers are just inescapable. With so many infections of people in the past 2 to 3 weeks, and the death rate that we're seeing among those infected, it's just a calculation that tragically the number of deaths will continue for the next few weeks. The thing that concerns me even more is that, bad as this is, we're just at the beginning. We still don't have widespread infection, and if infection causes immunity, it really would be still a very small proportion of Americans who are protected. Therefore, the virus has essentially an open field run. What we have to do is restart the economy without rekindling the epidemic.
But Dr. Frieden, everybody seems to be working so hard to flatten the curve. Clearly, we're not doing enough. You have another plan? You have a better idea?
There are a couple of things we have to do. One is to make sure we do a better job protecting those most at risk, including in congregate facilities. That includes nursing homes, which are being devastated by this all over the country, prisons, all correctional facilities, homeless shelters, meatpacking, and other close quarters where people work. That kind of context is resulting in explosive spread, and it doesn't stay there. It spreads into the community as well. But flattening the curve by staying at home is just one part of the equation of what we have to do. That's buying us time to build systems so we can protect our healthcare workers better, so we can box the virus in by testing, isolation, contact tracing, and quarantine. Those are the 4 steps of boxing the virus in. If we get all of them right, we can come out much more safely.
Yeah, we always keep hearing about testing. Yesterday at the White House, the press secretary said it's nonsensical, was her words, to get everyone tested, because she said, listen, an hour later, the results could change. An hour later, you could contact the virus. Does she have a point?
Testing is not a single thing. One of the things that I think we have to understand is this is a very complicated disease to fight. It requires a comprehensive approach, and testing is one part of that approach. Currently, we don't have enough tests in this country, even for the highest priority people. But even without that, there's a lot we can do by improving isolation, ramping up contact tracing, and ensuring that contacts are quarantined. Also, thinking about how to re-engineer our environment so that there's less risk, fewer doors to open with our hands, ways to push elevator buttons without possibly getting contaminated, making sure that we're sanitizing our hands when we enter buildings, thinking about how to work more effectively while physically distancing. There is not a conflict between economics and public health. There is the need to reduce the virus burden so we can get our economy back, and there's a need to get the economy back and our healthcare system back so we don't lose lives from the interruptions that COVID is causing.
The AP is reporting that the Trump administration is deciding to let the states decide when it's time to reopen instead of going along with the CDC guidelines. Do you think that's the right call here?
These are tough decisions. What we need to do is reopen gradually, learn lessons, try to figure out how to do that while protecting the most vulnerable people, recognizing that there are important economic activities that need to resume, recognizing that people can go outside safely in most environments, recognizing that there are workplace changes that can allow workplaces to reopen without risking the lives of workers and others.
All right, Dr. Frieden, thank you very, very much, sir, for your time this morning.